Good morning, everyone. This is Professor Yamini Bhushan Tripathi, a former Dean, Faculty of Ayurveda, Institute of Medical Sciences, BHU. And we are talking about palliative care, how holistic approach of healthcare, integrative healthcare can be helpful in giving the comfort and dignity of the terminally ill patients. But today we are going to talk what is the difference in rehabilitation versus geriatrics versus palliative care. These three terms are overlapping to each other. Suppose a patient of heart attack is there, or patient of paralysis, stroke is there. So he is not able to do his day-to-day job very easily. He is struggling to do the daily work. So now the patient is a subject of a rehabilitation. First of all, he is a subject of a doctor who is treating the disease. Then the heart attack is there, the cardiologist has taken care. He has given some medicine, the care. He has discharged the patient from the hospital. He has come to home. Now what is required? He wants to revive to the normal physiological state. That is the rehabilitation. And then geriatrics, and he's an old man. So old man means the heart attack, means aging. Old age itself is a cause of diseases. We say, Ayurveda says the old age itself is a disease, but in modern medicine we don't say old age is a disease. But old age is a situation when many chronic diseases are taking care of, are happening to him. So he is a comorbidity in the old age is very important. That has to be handled. Who will handle it? So there is a geriatrics department who handles this. And third come palliative care. Palliative care means if the geriatrics is also there, but palliative means the symptom management. What is the goal of palliative care? Symptom management to feel the patient comfortable with dignity and physically, with emotional improvement and physical improvement. That is the goal of palliative care. And geriatric care means the goal is to treat the old age comorbidity. And rehabilitation means the particular disease for which he has been treated for that. For example, a fracture is there, so physiotherapists go to do physiotherapy. A cardiac patient is there, heart attack is there, then other group of people are there to give rehabilitation. So we are going to talk about this. So what is the rehabilitation versus geriatrics versus palliative care? Rehabilitation means focus on restoring physical, mental functions after illness or injury. This is called rehabilitation. What is geriatrics? This is a specialized care for elderly people with age-related and chronic health conditions. See the difference. Rehabilitation means my focus is to bring him back physically and mentally after the disease has been treated. Geriatrics means to take care of those diseases which are along with the main disease, but because of the age problem. So geriatrics department deals this. And palliative care what? Aims to relieve pain, symptoms, disease symptoms, and emotional stress. These things are, pain is very important, mostly palliative care is given to the cancer patients. The cancer patient, the pain is very unbearable and no treatment is there. They ultimately go to the morphine. But that pain can be managed by your emotional feeling, by your counseling also. How the endorphins are secreted in your brain. Endorphin itself is the anti-pain. So if you want to control pain and if you are not able to control by medicine, then you go for this endorphin secretion, endogenous secretion of endorphin by psychological. Suppose you get a confidence, there is no pain, I can do it. What will happen? The pain will disappear. So pain can disappear if you are more confident. Not only medicine, your brain itself will fight against the pain. So these are the three things. Rehabilitation, I told you, focus and restoring the physical and mental function as it was before the illness. And geriatrics means to focus the old age related problems. During the disease, you are going on a rehabilitation, but because comorbidity of geriatric related thing, they manage. And palliative, we only focus on the symptoms so that you can feel healthy. Key difference, restore function, short, medium term and all ages. Geriatrics manages multi-morbidity, ongoing care and elderly only. And palliative care enhance comfort and dignity, not curative and age. Palliative care means dignity and comfort, only symptom management. This is the main difference. And geriatrics is mainly for old age people. Rehabilitation can be for any age. It can be short term, it can be medium term, it can be long term, depending on the disease. Overlap. A senior recovering from stroke, suppose stroke is there, paralysis is there, needs rehabilitation and geriatric care. A senior person, to geriatric care. Elderly with advanced cancer needs palliative care plus geriatric care because he is elderly and cancer. So, cancer is taken care by palliative care and old age taken care by geriatric care. And terminally ill may need all the three things. They need rehabilitation, they need geriatrics, and they need palliative. So, this is the difference. I wanted to tell you with an example. Now coming to what separates them. Each addresses a distinct goal, functions, age-related issues, and end of the life comfort. Okay? They require different skill sets, timelines, and interventions. So, geriatrics, rehabilitation, and palliative care. What is the difference I am talking in this slide? Ultimately, integrated care often combine all three for holistic management. Integration is also important because man is one. It is not in part. So, we have to see man in totality, depending on his age, depending on his condition, depending on his symptoms. Every unit, whether it is rehabilitation unit, whether it is a geriatric unit, whether it is a palliative care unit, all the three should integrate if you want to really serve a patient. Geriatrics, health care focuses on this is a citation I have made. Geriatrics, this is rehabilitation, this is palliative care. Overlapping. Elderly person recovering from hip surgery, comfort, dignity and chemo. Palliative care, approach to relieve symptoms and stress in serious or life-limiting illness. Rehabilitation, what is the process to help regain ability lost due to illness or injury or disability. This is rehabilitation. Regain the activity. Geriatric health care focuses on elderly with multiple chronic conditions. So, these are the three separate definitions I have discussed. The overlap, all the three things, elderly persons recovering from hip surgery, comfort, dignity and comfort. This is an example how they are overlapping each other. So, this is also I have given it the same thing in the table form for your convenience. Now, I am coming rehabilitation, geriatrics and palliative care in health care. Focus, restore function, supervised exercise, diet and medication. Adherence post-hospital. Post-hospitalization, three things are important. Supervised exercise, compatible diet and proper medication. What is compatible diet? You must ask by yourself. Compatible diet means a person which the food can be digested with a person. It depends on the age, number one. It depends on the digestive power, number two. It depends on the habit of a person who is eating before illness. And number four, what amount he is eating, what combination of food he is eating. But some people are okay with the curd eating in evening, and some people get khansi jukham if they take. It means it is not palatable, compatible to that person in that age. So, age is important, time of food is important, combination of food is important. All the three things. And fourth is the season. Seasonal things are better for a patient. If you are bringing things from cold storage, it may not be good for his health. So very important. Exercise is one thing, but diet is a nutrition. If nutrition is not there, nothing will help you. Nutrition makes your body. Nutrition makes energy. So this is very important. And adherence to the post-hospitalization treatment protocol. Last, improve heart efficiency, prevent rehospitalization. We are talking in the case of the heart failure, okay? Geriatrics in heart failure. What is geriatrics? Focus the manage the heart failure in elderly with comorbidities and frailty. Frailty means chances of falling down. I told you, in the old age, this is very common and we have to be very careful. Most of the people you have heard that he fell in the bathroom and he got a fracture. He was okay, he was doing everything, but suddenly he slipped in the bath. And the moment you slip, you get a fracture because your bones are weak now, you have osteoporosis like things. So you are not able, like a young boy, okay, healing is very slow, so very careful. Frailty is very important in elderly people. Assess polypharmacy, fall risk means a frailty, and cognitive status and ADL support. Maintain independence and manage chronic condition. This is the goal of geriatric expert. Palliative care in heart care, I have given all the three things. I have given you the rehabilitation in heart, I have given you the geriatrics in heart, now I am talking of palliative care in heart. Relieve symptoms and improve quality of life in chronic stage. Support the breathlessness. This is also very common because your respiratory rate increases because of your weakness. So that breathlessness is very discomfort causing factor. Fatigue, you don't feel energy, you don't feel like moving. So that fatigue and breathlessness both are interconnected physiologically and both should be addressed together. And third thing, you have lost the hope. Hope should be there. If hope is there, you will be always happy. To create a hope, a positive hope. Hope for what? Hope for not treatment of the disease. Hope for having healthy life. Whatever disease is there, I can live happily with that disease. That is the emotional movement one should create in the patient. And spiritual distress. And you know that in the end of life, you lose the support that God is there. Suppose you are having a very panic condition, you always curse, why God has given me this kind of stress. But have faith, you are losing faith in God itself because of your pain, because of your discomfort, but don't do it. How you will do? Somebody should be there to talk to you. Because in the Gita, very nicely it has been written. I am sure in all the religions, there is some kind of this kind of scripture. That scripture should be reminded in old age person who has suffered from heart attack and now he is in the end of his life. So these things are very helpful to them. Goal kya hai? Comfort, dignity and shared decision making at the advanced stage. Shared decision making. Share means what? Share means the patient and the family. So now I am coming, figure I have made, rehabilitation, geriatrics and palliative care. What is rehabilitation? To sum up the whole thing, what I have taught, a program to restore and improve cardiovascular health. Example, undergoes supervised exercise training and hospitalization. You know, in the most of the advanced countries, they pay for 7 days, insurance company cover 7 days hospital rehabilitation, not at home. If you are a heart attack survivor, they will give you 7 days to come to the hospital and do exercise and physiotherapists will take care. Geriatrics focus on older adults with multiple morbidities and age-related frailty. Example, assessed for fall risk and polypharmacy. Polypharmacy means how many medicines you are taking per day. 10, some people take 10 tablets and capsules, some people take 5 tablets. Polypharmacy, that has to be managed by geriatric. And palliative care means addresses the symptoms, relief and quality of life in advanced illness, relieve breathlessness and offer spiritual support. You see, I mean, treatment is not effective in that patient. What can you do? Just you can do a psychological support. This is important. I use a heart attack, stroke, and pain. I am trying to focus. Cancer, most of the time, when you talk of palliative care, we talk of the cancer patients. But few people talk of heart attack patient survivor or stroke survivor. I wanted to make what is the common thing in that? Heart failure management, stroke management, and the cancer management. Pain management, breathlessness relief, fatigue management, and psychological support. These are the common things which is present in heart patient, in stroke patient, and cancer. And in separately, the pain management in cancer, breathlessness relief, and fatigue. In cancer people, most of the people have these symptoms. So this is a specific palliative care, and this is a common palliative care. Everybody should learn, and any patient of these things will need these four things: pain management, breathlessness and relief, fatigue management, and psychological support. Palliative care is not about curing a disease. It is primarily about improving the quality of life, managing symptoms, and providing psychological and spiritual support. Remember it, it is not for treating the disease. Disease treatment is a medical profession, and palliative care is a human in totality. Human in totality. However, in heart failure, the line between treatment and palliative care can overlap significantly. Because heart patient, if heart is not proper, his body will not be proper. So there is an overlap. In the case of the heart attack palliative care, the cardiologist also plays a very important role. You have to put in the team cardiologist in the top. Because earlier a doctor was there because cancer patients has already been given radiotherapy, chemotherapy, now only palliative care. But in heart patient, this is not possible. You have to keep always a cardiologist in your team. The palliative care in heart failure is not about stopping treatment, but about shifting the focus. Treatment will be continued by the cardiologist. 100% treatment has to be continued. But as a palliative care provider, you can give a comfort over cure, quality over quantity, and patient-centered over disease-centered care. This is the three things we can provide as a palliative care giver. In advanced heart failure, some medications or interventions may still be used, not to cure, but to relieve the distress symptoms. Most of the patients, they are getting cervical pain. And cervical pain is the whole quality of life is changed. So in that condition, an expert should be involved because he is going to treat the cervical. If cervical is treated, the discomfort of the whole patient will go away. So you have to take care of. The tips for heart failure management in palliative care. Focus area, dyspnea, number one. So because heart is weak, a respiratory problem will be there. Fatigue, fluid overload, anxiety and depression, decision making, nutrition, and hospital avoidance. These are the main things which you have to focus as a palliative care approach. Use the low dose opiates. As I told you, if no drug is effective, only opiates are effective in the pain management. Fan therapy, positioning oxygen if hypoxia, energy conservation technique, psychological support for fatigue. Diuretics used not for cure but for reducing discomfort. Fluid accumulation, some people have the swelling in leg and all, this can be, diuretics are used. And counseling, medication if needed, family support. And anxiety and depression, only by talking, by interacting socially and spiritually, this thing can be done. Advanced care planning, discussion goal of care, decision making, how my patient can be more comfortable, that discussion should go with the family members and the patients. And the nutrition, as I told you, compatible food should be given to the patient. And in old age, the taste is also very important. If any good thing, but if it is not tasted to the patient, he will be psychologically ill. So give only those things which are liked by the patient. Even when it is highly nutritious but not palatable, he should not be given. This was the last slide, and I think I have tried to cover the main issues in the case of heart failure patients or the stroke patients. Both are the patients of that cardiology and in this. So thank you very much again for this lecture.